Have you ever wondered why some patients seem to withhold important information or hesitate to follow medical advice? You might think it's a matter of compliance or education, but the truth is, there's something much deeper at play. A breakdown in trust. Today we are going to talk about why building trust with your patients is not just a soft skill but the foundation of better healthcare, and why many healthcare providers fail at it. Trust or lack of it can make or break a patient's outcome. Now let's start by addressing the hard truth. Just having a medical degree or nursing qualification doesn't automatically grant you trust from your patients. I've learned that the hard way over the years. You walk into a room with your stethoscope and medical charts and you expect the patient to trust you simply because you have the title of nurse or doctor. But that's not enough. Patients are people with fears, anxiety, and their own past experience, many of which might have made them wary of healthcare professionals. When I was just starting out, I remembered one of my first patients. He was an old gentleman, and no matter what I said or did, he seemed closed off. I was giving him all the right instructions. Do this, take that medication, rest for these many hours, but he never followed through. At first, I was frustrated. I assumed he was just being difficult, but the truth was I had done nothing to earn his trust. I had come in, just like a walking checklist, not taking the time to ask how he was feeling or what his concerns were. I had treated the condition, not the person. So what's the key here? It's not about grand gestures or speeches. It's the simple act of asking, how are you feeling today? And really mean it. Listening to the answer without immediately jumping in with medical advice or corrections. In that way, trust is built moment by moment. Another example came during a particularly difficult shift. You know how it is in emergency. People in, people out. Time pressure, the constant noise and movement. A patient came in with chest pain, and while the team was running around, I took a moment to sit down beside him. Just sitting down, that's all it took. He opened up about his anxiety, his fear of having a heart attack, like his father, and how no one in the past had really explained his risk to him. That brief moment of sitting and listening helped calm him more than any medication we gave him, because it wasn't a heart attack. It was a little pain, it was fear, it was a dark circle. But here's the thing. Patients can tell when you are being genuine. They know when you are just saying words versus when you are actually invested in their care. And that's the first lesson I want to highlight. Trust is not something you can demand. It's something you earn. You earn it by being present, by listening, and by engaging. Let's break this down. Building trust with patients is about 3 key behaviors: active listening, empathy, and consistency. Let's start with active listening. Too often we think we are listening because we are hearing the words the patient is saying. But are you really? It's about catching those subtle cues. The hesitation in their voice, the way their body language shifts when they talk about something uncomfortable. I remember a young woman I was caring for. She had come in with something routine, a sprained ankle. Nothing too dramatic. But as I listened to her speak, I noticed something wasn't right. Her eyes kept darting away, and she seemed anxious about more than just the injury. By taking an extra minute to ask how she was really doing, I learned she was dealing with an abusive relationship. That one moment of active listening opened the door for her to seek the help she truly needed. And I know by now you are asking what happened to her. We got her to a crisis center, a lot of work in that. We got her to safe surroundings, and I don't know what happened to her after that. But I do know that the crisis center we sent her to, it's one of the best in the area I work in. But let's move on to empathy. We throw that word around a lot in healthcare, but it's more than just saying, I understand. Empathy is about putting yourself in the patient's shoes and treating them the way you'd want to be treated if the roles were reversed. I think back to the time when I was working with a patient who had just received a life-changing diagnosis. Instead of diving straight into the treatment plan, I paused. I let him talk through his fears, his what if, his frustration. And by doing that, I gave him space to process it all on his own terms. That's where real trust starts, in those moments where you are not rushing to fix the problem, but allowing them to feel understood. And finally, we have consistency. Trust doesn't happen in one conversation or in one shift, which is a bit ironic coming from an ED nurse, because most of the time I only see them for one shift. But trust is built over time, with every interaction you have with the patient. I've had patients who started out skeptical of every word I said, but by consistently showing up, keeping my promises, and being there day after day, things changed. And here's another case, an elderly woman with chronic condition who didn't trust the doctors at all due to past bad experiences. She suffered from schizophrenia, and that's where the bad experiences come from, because she had been through the rough part of the system. Not the modern part in Denmark where it is actually bearable, but the rough part back when violence, as she said, was part of the day. I don't know if it has ever been part of every day, but in her experience it was. So I made it a point to check on her at the start and end of every shift, even when I wasn't directly responsible for her. By the end of her stay, she told me she trusted me more than any other healthcare worker she had met. It wasn't because of anything extraordinary. It was the result of consistency. But there is another layer to trust that we don't often talk about: vulnerability. As healthcare professionals, we like to be in control. We train to have the answer, to be the expert, but sometimes being vulnerable with your patients, admitting when you don't know something or when you need to double check, is one of the most powerful ways to build trust. I have had many times where I had to tell patients that I wasn't sure about the side effects of their new medication. And instead of pretending to know it all, I have always been upfront, saying, I'll find out for you. That honesty has really earned me trust of many patients, because patients aren't expecting you to be perfect. They're expecting you to be human. And part of being human is admitting that sometimes you don't have all the answers, but they'll trust you to find them. So how does this translate into better care? Well, trust impacts everything. A patient who trusts you is more likely to be honest about their symptoms, follow your advice, and feel confident in the care they're receiving. And if you earn their trust, you're more likely the kind of person who, gets them to see coherence in their treatment instead of just compliance. And the patient are less likely to second guess you or resist treatment plans because they know that you have their best interest at heart. And it's not just about what's happening in the hospital or clinic. Trust extends beyond the wall of the facility. It means patients are more likely to take their medication at home, follow up on their appointments, and engage in their own care. It's a partnership, and trust is what makes that partnership work. And I leave you with this one. I once had a patient in the psych ward. This was back when I worked in mental health care. He was closed off, refusing to talk to anyone, isolated in his own little world. The team had tried everything. But after weeks of sitting with him, saying nothing, just being there in the room when no one else was, he finally spoke. It wasn't anything profound, but it was the beginning of a breakthrough. So what changed? It wasn't the medication or the therapy. It was the trust. It was the fact that he had seen someone show up day after day without an agenda, without forcing him into the conversation, but just being there. That trust took time, patience, and effort. But once it was there, it opened the door to real healing. And building trust with your patients isn't optional, it's essential. It's the key to better care, better outcomes, and better relationships between healthcare providers and patients. It's not about doing anything extraordinary. It's about the small, consistent acts that shows patients they can trust you with their health, their fear, and their lives. And now I want you to think about your next patient interaction. What will you do differently to build that trust brick by brick? And if you want a helping hand, then check out this video right here on Michael Bakhtin's theory. It's a theory that will change your view of building a relationship with your patients.